Good afternoon to all. Myself, Dr. Sunita Bhardwaj, and today I will discuss about the topic that is the clinical pharmacy. Okay, so the clinical pharmacy is defined as that the area of the pharmacy which is concerned with the science and practice of the rational medication use. The clinical pharmacy is that branch of the pharmacy which is concerned with the various aspects of patient care and deals not only with dispensing of the drugs but also on advising the patient on the safe and rational use of the drugs. The clinical pharmacy involves the participation of the clinical pharmacist in drug therapy decisions in patient care areas. In India, it is in the infancy stage. And now the what is the concept of the clinical pharmacy? The clinical pharmacy that is include the range of the services through which all the practicing pharmacists exercise their responsibilities toward the care of the patients, and it concerned with the rational selection and use of the medication at patient level. The need for the drug therapy must be assessed, and the appropriate drug and dose, the route, the form, and the frequency, and the duration of the treatment must be selected, and the drug have then to be ready for the administration. Okay, the whole process must be monitored, and the success or the failure of the outcome carefully evaluated. That is the much more important. The doctor, nurses, pharmacist, and patient must involve in the decisions which determine whether the prescribed therapy is appropriate for the patient or not. Among the major activities under clinical pharmacy include involvement in prescribing rounds, patient counseling, drug history taking, and parenteral nutrition services, pharmacokinetic advisory services, and monitoring for adverse drug reaction and interaction. Relatively, the minor activities include the health education, training and education of the own staff and the doctors of the hospitals, and the clinical trials, research, and clinical meetings. Now, the point on the objective of the clinical pharmacy. The basic goal of the clinical pharmacy is to optimize individual drug therapy for maximizing drug effectiveness and minimizing adverse drug effects. And the objectives that include the various points. The clinical pharmacy have first to assist the physician in doing better job of prescribing and monitoring drug therapy, to assist nurses in administering medication and documentation of the medical incidences, to maximize the patient role in the drug use process. Now, the function and the very important responsibilities of a clinical pharmacist. That is, first, the clinical pharmacist taking the medication history of the patient, that will conduct the much more knowledge about the history of the patient and the rational prescription and selection of the proper drug therapy, and the patient monitoring, the drug monitoring, what are the different drugs the patient used, and the drug adverse drug reactions and the various drug interaction, that is the various adverse drug reaction which take during their medications or during their IPD, okay, and they discharge the counseling and the patient compliances. the management of the drug policies, and the clinical research and continuing the education program, research and development program, and the medical audit and drug information. That is very important. The drug information, that is capital DI, that will include all the information about the therapeutic drug used for the patient, and the level of the action of clinical pharmacies. The clinical pharmacy activities may influence the correct use of the medicines at three different levels: before and during and the after the prescription is written. First, discuss about the before the prescription, that include the clinical trials and the formularies and the drug information and drug related policies. And during the prescription, that include the counseling activity, that is the patient counseling, that is very important to counsel the patient about their past history, and monitors, detect and prevent the medication related problem. Therapeutic drug monitoring, that is also a very important. The what the patient take, the medications, that should very therapeutic action, and adverse drug reactions and drug interactions means the patient, the IPD, the patient take the drug during this, and if they have the adverse drug reaction and the drug interactions, the medication used without the indications, and that is the another important points. And now, after the prescription, that include the counseling, that is same the patient counseling, which the patient take, what type of the drug patient take, and the preparation of the personalized formulation, the drug use evaluation, outcome research, and pharmacoeconomic studies. The clinical pharmacy services, the drug therapy monitoring or therapeutic drug monitoring, that is the TDM, and that is very important. The clinical practice of the measuring specific drugs at designated intervals to maintain a constant concentration in a patient's bloodstream, thereby optimizing individual dose regimens. TDM, that is the therapeutic drug monitoring, that will monitor about the therapeutic use of the drug. The TDM involves the tailoring a dose regimen to an individual patient by the maintaining the plasma or the blood concentration within a particular range. And what are the different objective of this therapeutic drug monitoring? The most important, to attain desired pharmacological effect of the drug, to reach the maximal effect in shortest possible time, their therapeutic index, and to decrease the risk of the toxicity. The TDM is useful in the drugs that is um, with a narrow therapeutic index, and which are highly protein bound and which are liable to interact, in which the metabolite might be toxic. The use of these drugs, that in the therapeutic drug monitoring, is very important for monitoring the rational use of the drug and the therapeutic use of the drug, that will less the adverse drug reaction as well as the side effects. Now the medication chart review. The medication chart review, a review of a patient's medication charts to identify the potential risk associated with the patient's medication and clarify the information that is not clear. Means the medication chart review help in the review of all the patient history that include the all the medications that has taken by the patients during the IPD, or that will identify the various potential risks, and that is very very important for the patient's medication accuracy and their clarifications for the further drug use, and that will help the patient for the recovery fast. And it is a fundamental responsibility of a clinical pharmacist to ensure the appropriateness of medication order. That is also the important point of that will contain a very very fundamental responsibility that take by the clinical pharmacist, and that will ensure about the accurate use of the drug that include the various points like the right use of the drug, the right dose of the drug, and the right route of drug administration of the drug, and the right time of the drug that taken by the patient. That these all points will recover the patients very fast, and their viability will affect, and the objective to optimize the patient drug therapy and to prevent or minimize the drug related problems and the medication errors. The medication chart review that will find the objective that the first the, to optimize the patient drug therapy, and the patient drug therapy include the all the therapy that will help for the accuracy of the drug dose and their administrations and the time of the drug and the various medications history and the routes. That is very very important for this, and to prevent or minimize the drug related problem and the medication error. If there is the medication chart review that will help to the for the patient for their um, use, and that will minimize the various drug related problems like the problem that arise the side effects or common side effects, or sometimes they arise the very adverse effect to the patient, and that will help to minimize these type of the problems. And the medication error, that is very very important. The medications error that involve or include the wrong route of the drug administration and the wrong dose and the wrong time, that will create a medications error to the patient. And now the component of the medication or error order review for checking that the medication order is written in accordance with the legal and the local requirements, isn't it? And ensuring that the medication order is appropriate with respect to the patient's previous medication order or the patient specific consideration, for example, the disease state, what kind of this, and during the pregnancy, and the drug dose and doses schedule, and especially with respect to the age, the renal function, and the liver functions. That also include in the medication chart review that will review about all these types and the all these points. First, the patient's previous medication order, that also include in the patient counseling and the patient specific considerations that we consider about the disease type or the disease states, and the what are the risk factor during the pregnancy, and the drug dose and the dosage schedules, especially with the respect to the ages, okay, and the renal functions and the liver function, that is very, very important. That will affect the biological functions of the body, and the route, dosage form, and the method of the administration, that will cover the accurate route and the time of the drug taken and the proper dose of the drug. The route and the dosage form and the various administration method also are the component, and that will ensure that the medication order is appropriate or not. And the medication duplication, administration time and administration record, cost, effectiveness, etc., that will represent the medication history, and that will review on the medication type and their uses, and what are the different the way of the route administrations and the exact time also, and the exact dose, that will also affect their viability. And now the clinical review. Clinical review, it is the review of the patient's progress for the purpose of assessing the therapeutic outcome. Means that will review on the patient's progress for the purpose, and that will also do the patient counseling first, and then work over them, and give the therapeutic outcome maximum. The therapeutic goal for the specific disease should be clearly identified before the review. That is very important. The therapeutic goal for the drug, that is the drug which is used for a specific disease treatment, and that will specific disease should be clearly identified. After that, the therapeutic use of the drug give their maximum response. And the objective of the clinical review include the assess the response to the drug treatment. Means that will very important for the assessment the response of the drug treatment, and evaluate the safety of the drug regimen, that should very clear, and assess the program of the disease and the need for the any change in the therapy if they need it, that has to be changed. Assess the need for the monitoring if any, and assess the convenience of the therapy, that will that improve the compliances, and that also overcome the presence of the side effects and the adverse drug reactions in the body after the use. And now the ward round participation. What is this ward round participation? That include the ward round participations are the routine clinical rounds where the healthcare providers visit the patient in the ward to assess the progress of the health condition of the inpatients. The ward round comprises of the unit of the medicine or any other specialty wherein doctors, seniors, residents, postgraduates, and interns, along with the pharmacists and the nurses, observe the patient's conditions and assist to decide further therapeutic for the patient. At least one visit is conducted every day to the review the progress of the each inpatient. That is very important. The ward round participation in the IPD patient, that should be there, and that will review their medications, and that will help in the patient counseling regularly, and what are kind of the drug prescribed or what are the dose given. That is very, very important to round the patient during their IPD, and that will help for the patient for their better care. The role of the pharmacist in ward participation. The major role of the pharmacist being an expert in the matter of the drug should be available for the ward round team to decide upon the matters of the doses regimen, formulary interpretations, and ADR, that is the adverse drug reaction monitoring, and the drug-drug interaction, and the drug-food interaction, and the drug and poison information service cost. That point is very, very important during the ward round participation. The point should be noted, the proper dose of the drug that has given to the patient during their IPD, and what kind of food they take, if that will prevent the drug food interactions, and what kind of the drug written in the prescription, is there any drug that will affect or create the drug-drug interaction that should be avoided there, and that is very important, and this round is very important for the IPD patient, and optimize the drug therapeutic management by influencing drug therapy selection, implementation, monitoring, and follow up. And that is the another role of the pharmacist in their ward round participation, that will work with the optimize the drug therapeutic management by influence the drug therapy selection and implementation, monitoring, and then follow. That the next point, that is the assimilate additional information about the patient, such as the comorbidities and the medication compliances or the alternative medicines, that also make the review with the patient of the IPD, and the participate in the patient discharge planning. Okay, that is also include in this their role in the patient. And now the medication history. The medication history, that is very, very important, that will interviewing a patient for the collection of the data related to the medical history, that is called the medication history interview. That will interview the patient about their medical history, the past or the present. And this history is very, very important for their betterment or for their the further treatment, either the IPD or the OPD. This point is very important, and this term is very important, and it provides the information of the patient allergic tendencies, adherence to the pharmacological and non-pharmacological treatments, self-medications with the complementary and alternative medicines. Means by taking the medication history of the patient, either the IPD or the OPD, that will help the doctors for the much more gain the much more knowledge about the patient disease and their treatment, and what are the different treatment which they do in the past or the present, and the availability of the detailed medication history at the time of the prescribing stage of the medication, and is critical to success of the diagnostic and the patient management task. And this point is also very important, the medication history that provide the availability of the detail, that will give the detailed history of the patient during their IPD, and that will help the doctor for the further treatment, and that overcome the another risk, and it assesses the rationale for the drug prescribed and appraise the drug administration technique. The medication history also assess the rationale for the drug prescribed, means there the prescribed drug that has been taken by the patient, and with the appropriate use, means the patient should take the proper route of the drug, and the proper drug with the proper dose, that will affect their bioavailability and the response. And now the pharmaceutical care. The pharmaceutical care involves the identifying, resolving, and preventing the potential and actual drug-related problems, and that include the prescribing error, and dispensing error, and the non-adherence with medications and the patient idiosyncrasy and the lack of the literacy related to the medication in the patient. The pharmaceutical care that is very important, and that will give the identification and the identifications and resolve the potential and the actual drug related problem. The first, the problem that is the prescribing error. The prescribing error, that is the fault in the dose selection or the omitted the transcriptions and the poor handwriting that are the common error. And now the dispensing error, that is the discrepancy between and the prescriptions and the medicines that the pharmacy deliver to the patient or distribute to the ward on the basis of the prescription. That is the discrepancy between the prescription and the medicines. And next is the non-adherence with the medication and the patient idiosyncrasy. The patient idiosyncrasy, that is the term used to describe and the unusual or the abnormal response to the substance or the medication that will also give the problem, and lack of the literacy related to the medication in the public, and that point is also very important. As we discussed in the previous slide, the medication history and the previous much more slide, that the patient counseling and the medication history of the patient is very important for the use of the drug, and taking the history of the patient, the past history of the patient. Upon that, the doctor uh, make a proper history of that particular present disease, and the medication history and the patient counseling, that is that prevent the risk of the another disease in the patient, and that will adherence the pharmacological and the non-pharmacological treatment in further, and that is the critical to success of the diagnostic and patient management risk. And by taking this type of the history, that is made very easy to the doctors for the further medications and the further use of the drug for their better carement. And the availability of the detailed medication history at the time of the prescribing stage of the medication, that is also important, because there include the administration of the drug and the taking the drug of the drug use for the treatment of a specific disease, that is the therapeutic use of that drug, and the time, and which mentioned by the doctor, the time and the dose, and that should be very very clearly or very accurately used by the patient, and that will overcome the another risk problem in the patient, either the IBD or either the OPD. Now, the pharmaceutical care, that is also an important point that will also considerable with the patient counseling and the medication history, and the previous we discussed about their medical chart review. That will these all make very very clear for the the doctors for their betterment care of the patients, and that will overcome the another the problems, drug related problems and the medications error, and that will potentiate the patient better treatment, and minimize or prevent the drug related problem or the another adverse drug reactions and the other side effects. And this medication chart review help in for the very very clear for the patient the medications and their clarifications. that is their previous history, and that will this very very important, and that will clarify the information about their disease in the previous, and what kind of the drug at that time they use, and what if there is the side effects or the adverse reaction is there or not, and what kind of the drug has taken by the patient during this, is there is the drug interaction or there is the drug food interaction during that time period, IPD or the OPD, and the for their disease, and this will help for their treatment. And fundamental responsibility of the clinical pharmacist means the clinical pharmacist play a very very important role for making this type of the history or this type of the medications orders, and that is very very appropriate, and they do their duty, responsibility, fundamental responsibility, and the low the risk of the patient's medications history error, and their medications error that will also affect the patients for their um, disease, and that will also affect or create the other adverse reaction in the body, and that will very create the high risk for the another disease, and the medication and the medications error, and the prescribing error, and the describing error, and the patient idiosyncrasies, these all affect their treatment, and the prescribing error, sometimes the poor handwritings that are the common that has not be proper read by the pharmacist, and that will also create a problem for giving the drug, and the use of the drug and the administration of the drug, that will also a point, and that is very very common, and dispensing error is also there, that the dispensing error, that is that is the discrepancy, and the discrepancy that between the prescriptions and the medicines, and that will um, for the deliver to the deliver by the pharmacy to the patient, or distribute the ward on the basis of their prescriptions, and if their prescriptions or the better use of or the better read of the prescription is not there, that will also create a problem, or that will also create a potential risk to the patient, and there is a patient idiosyncrasies sometimes there, that will also affect the patient treatment, and the patient idiosyncrasy, that the term that describe, and the unusual or the abnormal response of the substance or the medication, that is very important, the unusual or the abnormal response of the drug that has been come after this type of the complications, and that will affect the problem, and these the patient counseling is there, the patient counseling about the if the doctor or the medical staff take the medical history, and do the patient counseling very clear, that will affect their treatment further, and that will lower the side effects, and that will lower the adverse reactions further, or any other common effects, that will reduce their, and the patient idiosyncrasy, that is much important there, and that will reduce, and due to this, and the patient medical history, and their chart review, and that will review the all the medications of the patient, and their clinical studies, and that will optimize the patient treatment, and the further their will affect by the medication, that will affect by the um, this type of the error, and now the this slide we read, that is the medication order review. The medication order review that will review the various point here and the patient specific consideration, that the what type of the disease is there and what kind of the drug she take, and that should be very clear. The appropriate or the accurate use of the drug with the disease state, and the drug dose and the dosage schedule, the schedule of the dose or the given time that should be followed by clearly, and their route of drug administrations and their medication duplication should be avoided there, and the record, the administration record, if there is any type of the drug that has skipped by the patient, that should be also there, and that will also maintain their record and maintain the health of the patient. And the drug, this type of the drug dose and the wrong dose or the wrong time or the wrong administration of the drug, that will affect the biological function of the body, and that will affect the mostly the liver function and the renal functions for their proper functioning. And the patient previous medication order or the medication history, that will help the doctor very much for their further uses. They know about the what kind of the case is there and what he have to do, and the what is the patient take the problem, they take the drug for the problem, and if there is the dose or the disease or the time that is clear or not, that all kind of the error that has been reviewed by the doctors, and then the further chart review will report. And the clinical review, the clinical review there, that will evaluate the safety treatment for the patient, and that is the mostly for the review on the purpose of assessing the therapeutic outcome. And the therapeutic outcome will increase when there is better known the type of the drug or the kind of the disease of the patient, and what kind of the drug he or she take, or what type of the route administration there, and that all are involved in this. And their all review, clinical review include only and only assess the response of the drug treatment, and the better the use of the drug with the proper administration or the proper time, that will reduce the error of the drug, and that will respond very better, and the evaluate the safety of the treatment regimen, and also progress the disease of the disease treatment, and also assess that, and assess the need for the monitoring if any, or assess the convenience of the therapy to improve the compliances. Means the clinical review here is very important for review the all the clinical parameters which has in the patient in past history, or that will include the all the patient counseling, and the all the medication error or the prescribing error or the dispensing error, or the patient idiosyncrasies, the drug adherence, etc. These all are very important, and that will affect the health of the patient. Means the clinical review and the medication chart his review, and the medication error and the patient counseling, these all points or the all the concept are very important for reviewing the um, patient previous history, and upon that the further the doctor can make the very clear fresh history about the patient, and write the medication accordingly, and prevent the drug interaction or drug food interactions or any other side effects or any other um, adverse drug reactions, and that will increase the betterment of the patients by considering these type of the concept or these type of the component, and that is very very important in a clinical pharmacy, and that will help for the betterment of the patient care, and that point should be there, and that point should be clearly followed by the doctors, and these all objectives of their points should be there, and there should be reduce the prescribing error first. That is a common problem, and that is spreading the much more error in the patient, and that there is also reduce the dispensing error and the patient idiosyncratic effect, and that also make a better treatment of the patients. And by following these all counseling or the chart review, the medications error, prescribing error, and all these clinical review or the clinical components, these all are followed by the clearly by the doctors to minimize the less more effects. Okay, so thank you for your attention and the time, and I hope that you gain the valuable insight and connection from the events. Thank you.